Salt-loving nation, but this habit that could see dying a lot sooner than we bargained for, warns health experts during National Salt Awareness Week. And salt is the major factor that increases blood pressure and is therefore indirectly responsible for many heart attacks and strokes annually. According to South Africa's leading provider of cardiovascular medication, heart-related disease today claims more lives than all forms of cancer combined. But to unpack the salt story further, in our Sea Point studios, we're now joined by Mariska van Aswegen, the spokesperson for Pharma Dynamics. Mariska, very good morning to you. Thank you for your time.
Good morning, Timile. Nice to join you.
Now, according to your research, why is the nation so in love with salt?
Timile, we have a problem in the sense that we need to desensitize ourselves. So we've become so used to taking in high quantities of salt daily, and a lot of the times it's more habit than anything else, especially if we look at our discretionary salt use, which is basically the salt we add on at the table after the food has been prepared, just before we eat. A lot of South Africans add salt before they have even tasted their food, and in South Africa it's about 40% of our salt intake is due to discretionary salt intake, and if we compare that with the rest of the world, especially westernized countries, they add only about 15% of the salt at the table. So it's a lot of habit that increases our salt intake in South Africa.
Now, Mariska, I understand there are many risks related with too much salt eating, but why is heart disease amongst the leading causes, of taking too much, the leading results of taking too much salt?
As you've mentioned earlier, salt has a direct effect on your blood pressure, and if you take in too much salt, and especially if you've already been diagnosed with a condition, it can increase your risks to develop heart disease and stroke. And to put it into perspective, in South Africa, daily about 140 people suffer a heart attack, and 240 have a stroke. So that just brings it into perspective how important it is for us to try to eliminate the risk factors for heart disease, and then for obviously increasing our risk for high blood pressure, like just making a simple change to reduce our salt intake.
So what then is the safe recommended daily intake of salt, would you say?
The World Health Organization recommend a daily intake of about 5 grams of salt. In South Africa, we, on average, adults use about more than 40 grams of salt. So that just gives you an indication as to how much more salt we consume than the rest of the world.
Now, again, Mariska, except for the salt that we add, of course, to food ourselves, as you've mentioned, sometimes we even add salt before we even taste the food. Which other food we buy do you think has too much salt, would you say?
That's a very important point. It's about 75% of the salt that we take in on a daily basis already contained in the food that we buy. And the main culprits are usually your processed meats, and we consume a lot of those. That's your salamis and your sausages and your Viennas and ham and bacon, etc. Then your pre-made sauces and soups, etc. Those canned soups, they contain a high level of salt. And of course, the snacks that we enjoy, your salty nuts and your crisps, etc. And one food group that we always forget is cheese. Cheese actually contains a high quantity of salt, and we should avoid eating too much of that at the end of the day.
Alrighty then, Mariska. Now, as part of Pharma Dynamics' ongoing education campaign to help curb the growing incidence of cardiovascular disease, you have, I understand, introduced some initiatives. Please tell us more about that.
Absolutely. We have joined hands with the Heart and Stroke Foundation about 3 or 4 years ago, where we brought to light the Cooking from the Heart recipe book series. We currently have 3 books in the series, and we try to show South Africans how to make these lifestyle changes, because it's often just a small change that you have to make to reduce your risk for developing disease. And we know that 80% of heart disease can be prevented by adopting healthy lifestyle choices. And the recipe books teach you how to read food labels, to be on the lookout for these hidden ingredients that's often not just listed at salt, but often listed at sodium, for instance, what to be on the lookout for, and also what changes to make, small changes that you can implement by, for instance, rather put a slice of lemon on the table and squeeze that on your food instead of reaching for the salt shaker. You have exactly the same beautiful taste on your food, but you reduce your risk for developing diseases like heart disease, for instance.
Sure, Mariska, I can just say, just by having this conversation with you, I already feel like I need so much to learn concerned about when it comes to food, especially the packaging on our food? I mean, for the fact that you mentioned the point about, hidden ingredients there like sodium, whereas we may think salt needs to be written and, the grams, intake inside the food, that is very informative. Now, before I let you go, I understand there's also National Salt Awareness Week. Take me through the importance of having such an awareness program.
The importance of Salt Awareness Week and why Pharmacodynamics supports Salt Awareness Week is the fact that we need to educate people. We need to create awareness of the risks associated, because often people won't make these changes if they don't realize what those risks are. And for us, it is also important to give alternatives. So I encourage South Africans to go to cookingfromtheheart.co.za website. The recipes and the recipe book is downloadable for free. That was very important for us. We need to make these resources freely available to all South Africans, and find these alternatives, fresh herbs and spices. Introduce those into your preparation of foods, and it will make a difference and can reduce your risk for developing heart disease.
All right, Mariska, thank you so much for this very informative and educational conversation. Thank you so much.